Yes, please. Thank you.
Okay, sige. So, good afternoon. Can you hear me?
Yes, Jem.
Okay, sige. So, can you see my slides?
Yes.
Okay, so this is the first for this year, school year. I am the first to lecture, and this is very important because
Jem, you can't open your video.
kaya di rin na ang open. Amala tatak problema.
Di rin na open. Actually, naka-open ka na ano?
Kanina, ambot na wala.
Naka-open ka na. O sige, I think the problem is your connectivity.
Oo.
Sige. But for those of no problem, make
sure. Ko na lang adjust. Sige. Akong video. Naka-share na. Ay, ako dit nakikita nira. My video. Na like la. Sige, anyway. I will just start kahit walang video. So there are, how many are you? 99 ang nakaano.
120 baka mo tanan?
118. There are 118. Upod ka pa, Dr. Edna.
Minus 2 kita, 116 la.
Oo.
They are 120 actually, so 4 are absent.
So anyway, hinatakon co-host.
Damo hira.
Damo hira? Oh, okay. Sige, sige. Anyway, we'll start because I think we have to be finished.
Kailang 5, Jem.
Oo.
Until 5.
Sige lang kay itakson duluwat bangin maghinulat tinduro. Anyway, so we'll start. So this is the first lecture, approach to diagnosis, meaning to say how you will go about with the next, how you will go about in the diagnosis, or very important if you have the correct diagnosis, how you will treat your patients. So ayan. Okay, so the objectives for today and the succeeding days is to review general strategies of history taking, to review parts of the pediatric history, and then to how to go about with physical examination, and then the parts of physical examination. So this is actually a flow diagram wherein it will show that by doing history and physical examination alone, without the laboratories yet, you can arrive to an accurate working diagnosis. So 80% or more of the basis for your diagnosis is having a correct and thorough history and physical examination. Your laboratories will just support what you were thinking about the disease that you are thinking about in your patient. And then you will have, if you have now your final diagnosis, you will treat your patient effectively. You will be giving the correct medications, you will be ordering the correct workups. Yeah. Okay, so very, very important, and it is very unique in doing pediatric history taking is because your your patient is not an adult, so pediatric here. So some of your patients would not be able to verbalize, they would not be able to describe to you what they feel, if they have pain, and usually it is very difficult to establish rapport. Kasi you will be considered, especially for older children, you will be considered as a stranger, more so if you are wearing white. It's very difficult to get your patient's confidence. Very difficult. And also you have to take into consideration the developmental stages depending on the age of your patient. Like for example, you want to ask about headache, you cannot ask about headache in an infant. Your infant cannot still verbalize or point what or where the pain is. So as the child matures, fewer nonverbal strategies are used. You can also make use of toys. That is why if you have visited clinics, pediatric clinics, there are toys and things that can distract children or your patient. You can let your patient draw. And also for older children, you can talk to them about school and their hobbies. So ayan. So history taking is an art acquired through experience. So as you go along, so probably the first time that you do your history and physical examination, it can be awkward. So the pediatric history is unique in the sense that children are not miniature adults. We cannot consider them as miniature adults. And the difference from an adult history to a pediatric history, walang prenatal and birth history sa adult, there is no developmental history, feeding history, immunization history, wala yan. Social history and environmental history. So that is the difference between a pediatric and an adult history. So you need this additional data. Okay. So if you have a neonate, very important is the maternal history. So maternal history, it means that you have to get the history of the mother's prenatal, so during pregnancy, and then during delivery, after delivery, what happened, the events that happened that is contributory to the present condition of your patient. So for infants and toddlers, iba naman ang style mo. You just at first observe, because these are the patients whom usually there is stranger anxiety, especially toddlers. So you observe first the gait, or how the patient's mood, and then so depending on the age group, preschool, the patient can now be interviewed. Pwede na siyang mag-verbalize, especially school children. So they can already contribute information in your history taking. Adolescents, kasi pediatric history is up to less than 19 years old, up to 18 years old. So they can be interviewed without the parents. So separate ang interview ng parents and the patient, the adolescent. And confidentiality is very important for them, especially if you are asking about behavior, sexuality. So very important that they should be told that information that you get from them should be kept confidential. Okay. So in pediatric history, we usually have the source of information. Sino ba ang source of information? Because more often than not, palagi siyang may kasama. It's either the mother, the father, the grandmother, or the yaya, even the yaya. So the most reliable source for your history is the one who is always with the patient. Okay. So most of the time, the data or the information is provided by the parents, the caregiver, or any companion of the child, always who is with the child. So you also write the informant's name and the relation to the patient. Like for example, mother ba siya, yaya, or the grandmother. During your first contact with your patient, you can start with the parents or the guardian in a positive note. Probably you can greet and then introduce yourself kasi during the first contact, yan ang the time when your informant and your patient will trust you with information. If they will perceive you as like straight, so information will not be freely given to you. Okay, reliability of the informant is expressed in percentage. Reliability meaning to say, if your informant is just the person who found your patient in the street, so percentage reliability would be low. So like only 10% kasi nakita lang nila sa karsada yung patient, pinulot lang. But if it is the mother who is always with the patient or the yaya, the percentage would be higher. Now this would depend on the relationship to the patient, as I said earlier, the amount of time spent with the patient, the degree of involvement in the care of the patient, and of course, the educational attainment. So siguro, dito sa educational attainment, if between the mother and the yaya, na hindi naman masyadong nakapasok sa school, so more or less the mother would be able to relate or to tell you important information. And then important also is if this is a referral from where? From a district hospital, from the RHU, or from a private physician. So you have to write it also in your history. So the first part of your history is the general data. So the general data would tell us the patient's name, the age, and then the date and place of birth, kasi very important. The very important is the exact date of birth, because you have to be very exact sa age. You can compute for the exact age of your patient. Because different age groups, different diseases, also different normal values. Like for example, respiratory rate. Iba ang respiratory rate of a newborn to that of a toddler and then what is considered as tachypnea or tachycardia. Different age groups have different normal values. So when you place the age, you do not round off. Like for example, 1 year and 2 months, you do not round off to 1 year. Okay. And then of course, the gender of your patient. Kasi there are illnesses that are common in males, pediatric illnesses that are common in females. So ilalagay din. Race and ethnicity is also very important because of diseases that is common in like for example, region 8, ano common didiha like cysto. Sa in other areas, iba naman ang mga diseases. Or other, kung galing abroad, what illnesses probable that this patient has been exposed to. Okay, religion, the same. Especially in the management, like for example, your blood transfusion is not allowed in some religion. Also, about immunization, some of them because of religion hindi magpapa-immunize. So depending on your patient's affinity. And then present address, and then the number and date of hospital admission. How many times was the patient admitted for this? Or were there previous hospitalization of the same nature? So ilalagay yan. Chief complaint. The chief complaint is the reason why the patient was brought to the hospital. This may be a single symptom or a group of related symptoms. Like for example, a patient who came to you because of damo niya problema, fever, cough, difficulty of breathing. So the most recent reason why the patient was brought, yun ang ilalagay as chief complaint. If the fever has been there for 5 days, so probably that is not the reason why your patient was brought to you. Your patient was brought to you because the patient was already having difficulty of breathing or diarrhea for 5 days. 5 days ng diarrhea, but the patient was brought because the patient was already weak, dehydrated. So the most recent manifestation of your patient, why your patient was brought, is your chief complaint. So do not include diagnostic terms or names of diseases. Hindi pwedeng chief complaint, dengue, like that. And then you can also mention the duration of the symptoms, like for example, difficulty of breathing for how many hours. Now we go now to the most important part of your history taking, is your history of present illness. So this is the main the meat of your history taking, because this would include the signs and symptoms of your patient. However, it should be reported or written in chronological order from the start of the illness. Not you do not start from Masaringka 2 days had diarrhea, but there was fever for 5 days. So unahin mo ang fever. Okay, indicates specific number of hours, days, weeks, or months for the time of onset of chronic illness. So date and age of onset can also be stated. In newborns, iba naman in newborns or in case of present problems related to prenatal or perinatal period, maternal and birth history should be incorporated in the HPI. So ayan. So ang neonatal history would start with the maternal and birth history. So like for example, the patient was delivered to a 36-year-old gravida 1, para 1, mother who had prenatal checkup starting at 3 months prior, at 3 months age of gestation. So you start, if your patient is a newborn or a neonate, you start with the maternal, prenatal, and birth history. Okay? So yun ang magiging HPI nyo. Yun ang magiging history of present illness. Or if your patient's problem is a congenital one, even if your patient is not a neonate, if the problem is related to the maternal and birth history, your HPI would start from the maternal, prenatal, and birth history. So the symptoms should be described according to onset, if it is acute or chronic. So you have to learn ano ba ang chronic cough or chronic or persistent diarrhea. You have to learn the definitions. And then also the intensity of symptoms, whether it is severe or just it just appears when the patient moves like that. Describe the quality. Pag quality, ano yan? Like, like on and off, colicky, abdominal pain, located initially at the epigastric area, lasting for 5 minutes. You can also grade the severity from 1 to 10 in pain scale. Like that. So like for example, this is associated, you can also have associated symptoms like vomiting or whether there is any hampering of usual activities like your patient cannot stand. So you have to describe. And then what are aggravating or relieving factors? Like for example, relieved by doubling up. Or by lying down in bed with on the right side. So ganito. Okay? So those are aggravating or relieving factors. Then if there are intake of medications, you write the generic and you can also write the brand name in parentheses. And then you can compute for the actual dose so that you can determine whether your patient is given the recommended dose or given overdose. Okay. And then for how many days treatment. And then also any outside or medical treatment given, even if at home lang, self-medicated by the parents, or if there was a consultation done, or the patient was hospitalized or brought to other centers. And then what are the associated symptoms? Like for example, fever. Was there was there vomiting? Was it associated with vomiting, diarrhea, cough, or colds like that? So just mention the causes, other symptoms noted. If it is related to the present problem of your patient. So remember, you already have when you interview your patient, you should have a you should have something in your mind. What is the possible problem of your patient? Meron na kayong in-entertain na disease entity. If you already have while you are interviewing. So ask for the signs and symptoms characteristic of the disease. Like for example, fever, nag-entertain ka. There are so many causes of fever, but at the present time, what are the possible diseases na uso during this time? So COVID, dengue. So what are the signs and symptoms of COVID or dengue? So you can ask during your interview. So dapat you have a stock knowledge of the different disease entities. Pag mag-interview kayo, mayroon na kayong background of the different disease entities that you can entertain. Pertinent negatives. Okay. Pertinent negatives, ano ba yan siya? So these are the things that you will ask na probably wala ang patient. Like for example, you ask for seizures in a patient with fever. Kung walang seizures, that becomes a pertinent negative. Okay. Also, very important, previous consultations or admissions to hospital. If you can obtain records, you can summarize the consultations or admissions if it is related to the present problem of your patient. So based on the history of present illness, you can already have an initial impression and several differential diagnoses. So yan ang what is important in doing your history. So when we say interval history, this is a description of the course of the illness since the last hospital admission of your patient. Like for example, asthmatic ang patient na admit last month. Okay? So you have to summarize the previous admission. Kung the same problem lang naman. What at the date of admission, how many days the patient was admitted, what were the medications given, and at home, after discharge, what happened to your patient until the time that your patient came back. Okay, so you can now have your initial impression and differential diagnosis. Review of systems. Now, this is a review of the symptomatologies. You review the symptomatologies of your patient based on the organ systems. So do not confuse this with physical examination. So elaboration of data in systems not covered in the HPI helps to uncover related symptoms in other organs or systems. And you ask symptoms applicable to the age of your patient. Okay? So by system, para hindi nakakaligtaan. So you have a detailed description of symptoms. Okay, so these are the things that you have to ask. So you ask this from your informant, from the parents, or from the patient himself. Did the patient have weight loss? The activity, was the patient weak during the time that the symptoms were noted or the disease or the illness started? Okay, were there rashes noted? So you ask this from the parents. This is not physical examination, huh? Okay. The head, so meron bang headache? If it is applicable, was the patient dizzy? If applicable, depending on the age of your patient. Was there visual impairment? Like for example, pag nag-high blood, was there blurring of vision? Hearing difficulties? So lahat yan, you have to ask. You ask, not You do not look at the patient. Iba ang physical examination. This is symptomatologist. This is still part of your HPI. You just ask questions about symptomatologist at home, noted at home by your informant or by the parents. Okay, sa cardiovascular, you ask whether nagcyanosis ba or was there easy fatigability, fainting spells. Okay, respiratory, you ask if there is cough, chest pain, or difficulty in breathing. Gastrointestinal system, bowel movement, diarrhea, abdominal pain. So you ask for that. These are still symptomatologies. Okay, genitourinary, color of the urine, frequency, edema of the hands and feet. Okay, if your patient is an adolescent, was there genital discharge or itching? Yan. Pag female, menstrual period, regularity of the menstruation, the date of last menstruation. So, ano yan? Review of systems. Endocrine, may palpitations, cold and heat intolerance, polyuria, polydipsia, polyphagia. Nervous or behavioral. So, hindi to pwede sa 1-year-old. Again, age specific. You can probably ask for sleep problems sa adolescent or sa mga toddlers. Pwede na ba sa toddlers? Mental deterioration, especially now at this time. Behavioral changes. Okay, eating problems, school failures. So sa behavioral siya. Sa neurologic, sa nervous, yung mga tremors, seizures. Okay, so you ask for that. Sa review of systems. And then musculoskeletal, limitation of movement, stiffness. And then sa hematopoietic, bleeding, hematoma formation, pallor, easy bruisability, prolonged bleeding, like that. So you can ask that as information for your review of systems. And then past personal history, this may yield significant data related to the signs and symptoms of the disease. So very important, mga past illnesses. Included here is your gestational history. The age of the mother during pregnancy, parity, ikapira nga pagbuntis, ilang the birth rank of this patient. And then the health of the mother, nutrition of the mother, infections incurred by the mother during pregnancy, intake of drugs, X-ray exposure, and duration of gestation. Ano ba siya? Term or premature. And then birth history during delivery. Ano siya? Term, premature, or post-mature. Manner of delivery, normal delivery, bridge, assisted, forceps, who assisted the birth or the delivery. Doctor, nurse, midwife, traditional birth attendant. Birth weight of the baby. Use of oxygen if needed. And then was the baby admitted to the ICU, the neonatal intensive care unit. If there were birth injuries at birth, feeding problems, congenital anomalies, and then the length of stay. Kasi usually pag normal deliveries, ano lang siya, 2 days or 3 days, more than 24 hours discharge na if there is no problem. So neonatal history, what happened from birth up to 28 days, neonatal history. So you can ask about the Apgar score. Anyway, this Apgar score, this is the meaning, appearance. So anyway, you will be discussing this when you go to your neonatal history lecture on newborn medicine. The respiration, kailangan ba i-resuscitate ang baby at birth? Was there cyanosis, pallor, or poor cry, jaundice at birth? Kasi you have your physiologic and your pathologic jaundice. presence of convulsions, hemorrhage, respiratory or feeding difficulties, and then presence of congenital anomalies or birth injury. So this is included only for patients less than 2 years old. Kung more than 2 years old na, you don't have to have your birth and neonatal history. But if the problem of your patient is related to the birth and maternal history, you have to have your birth and neonatal history. Feeding history. Pag less than 2 years old, you have to describe the feeding. Exclusively breastfeed ba or formula feed? Exclusive breastfeeding for the first 6 months means no other food or formula given except breast milk. So even water. Pag magbigay na ng water, hindi na siya exclusively breastfeed. Frequency of feeding per day, how many times in a day? You should know the normal. A newborn should be fed how many times a day and the duration for each breast. Kung breastfeed. If not breastfeed, what is the reason for not breastfeeding? And then you can also mention the formula used, how it was diluted, and the amount consumed per feeding. How was feeding given, by bottle or cup? Okay, complementary foods, you should know at what age it was introduced, first introduced, and then what was the first food given, the consistency of the food and the frequency of giving the complementary feeding per day. So yan, it should be enumerated. The usual food intake for breakfast, and then you lunch, dinner, and include your snacks. The amount, very important is the amount. You compare the actual caloric intake with that of the recommended energy and nutrient intake. So you have to have, you should know the normal, know the normal amount for different age groups. Okay, amount and quality of food intake compared with the food pyramid. Were there food intolerances? Given multivitamins, supplements, and the dosage and frequency. Who usually feeds the baby? The mother, the household help, grandparents, or another sibling. So pag 2 years old to adolescents, this is usually not included unless there is a problem with the feeding. So you have to assess the appetite. Is the patient a picky eater? The amount of food per day for breakfast, lunch, dinner, including morning and afternoon snacks. Okay, what are there food dislikes or likes? Ano ba? Palagi lang chicken, chicken, and chicken. Are there feeding difficulties? Multivitamins and iron supplements, are they being taken? And then developmental and behavioral history, your developmental milestones, where it achieved according to the age that it should be achieved. School-related matters, grades, interaction with peers, and then behavior. Enuresis, temper tantrums, ano ba siya? Is it normal for this age group? Thumbsucking, at what age dapat siya hindi na mag-thumbsuck? Okay, paika, the eating of food that is not dapat kinakain. Okay, so for developmental and behavioral history, for young children, you can use the modified developmental checklist. Anyway, you will still be having your lecture on developmental and growth and development. Toilet training, that is included. Temper tantrums, head banging, phobias, night terrors, sleep disturbances, and other behavioral problems. So use your DDS if there are indications of developmental delay. Anyway, you can refer, but you should know how to identify a patient with developmental delay. Depending on kung language, motor, ang delay. For adolescents, you have to use your Tanner's maturity rating for sexual development. Also take note of the school performance and then the menstrual history for females. Okay, this is your Tanner scoring for males and for females. So breast for males and female. And then the genitalia for males and females. Okay, so if you have an adolescent patient, you have to ask about the home, anong situation sa home, the education of your patient at school, ano bang ginagawa, eating behaviors or habits, activities, ano siya, sports-minded, use of drugs, sexuality, may ano ba siya, identity crisis or ano ang preference, sexual preference, and then practices also, sexual practices. That is why sa adolescents, you have to maintain or tell your patient that all information are kept confidential. Suicidal ideation, especially now, very difficult, especially at this time na usually ang consultation is telehealth, by teleconsult. And then, of course, spirituality. So past illnesses. So what were the illnesses previously? Even if your patient was not admitted, just treated at home. So that should be included. How many times in a year? Like for example, ubo. How many times in 1 year does your patient have cough or colds? Because this will tell us the condition or the health condition of your patient, if your patient is sickly or not. Presence or did the patient have contagious diseases, mga infections. And if your patient became ill, na hospitalized ba, where, and for how long. Operations, if your patient was operated on, and anong type of operation. Presence of history of allergy, asthma, food or drug sensitivities, and then injuries. You have to describe how was the patient injured, na hospital ba or what. Immunization history, very important. Date, what was the vaccine given, date and when the vaccines were given, saan siya in-administer, not only where, but the site. Because sometimes the parents or your informant does not know saan ba, the name of your vaccine, but you can ask saan the site of injection. Was it on the right? Was it on the thigh? Okay. And then further untoward reactions. Although tuberculin test is not a vaccine, if your patient had this, you can probably write what was the result. And if, as much as possible, you ask for the immunization record. So these are, anyway, you can download this. These are so you should know the schedule. At this age group, ano ba ang dapat na vaccine? Like for example, at birth, the patient should have received BCG and DEPA-B. So you can download this. Family history, ask for the health of the parents, the age, occupation, anong trabaho, state of physical and mental health. If disease, the age and cause of death, ano ba ang symptoms, and history of consanguinity. Siblings, you have to enumerate how many siblings and the ages, the state of health of each sibling, and then if not living, also the age and cause of death. And then illnesses in the family, like tuberculosis, diabetes, ano ba, mga hereditary hematological disorders, mental. Okay. So you have to ask family history. Socioeconomic history, the living condition, the house, where is it located, how many persons living in the house, because you can have a clue as to whether there is overcrowding. Saan siya, sa near the highway or in the rural area. Economic circumstances, who is providing for the family. Father lang ba? Are there aunties or lolas who help in the economic circumstances of the family? Okay, environmental factors detrimental to the child's health, like for example, mga toilet. Do they have toilet? What type of toilet? Exposure to smoking and other pollutants. Are there pets at home? How do they dispose of their garbage? And then human waste disposal, the water source. Okay, so I think for the next meeting, we'll proceed with the physical examination. Anyway, the source, I think, was already mentioned by Dr. Ayaso earlier, your fundamentals, and then the handbook on physical examination, history and physical examination. Okay, do you have questions so that you can prepare for tonight's activity? My question? Wala? Okay, so let's call it a day. So, ang attendance ha, ano na lang ha, who takes charge of the attendance?
Ako po, Doc.
Okay, so do you need to have a video or picture? Merong
Nag-screenshot na po ako, Doc.
Okay, sige, okay. So that's all for today. So next meeting would be next Monday. I-text ko na lang sino ba ite-text ko? Si Ian pa rin?
Iyan po.
Okay, sige. We'll start at 4. Di ba 4 o'clock man ang start dapat? Or 3. You want it 3? 3 to 5. Or 3:15 para may break from your previous Anyway, you just decide. I'll just let Ian inform me or mag-text na lang. Okay? Okay, sige.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Doc.
Thank you, Doc.